Yeah, thank you, ladies and gentlemen. My name is Victor Obasuyi, and the channel is My Take on It with Dr. Victor Obasuyi. Today, I'm going to be talking about remedies for dry eyes. I did one video last time about dry eyes, and the response was really overwhelming. Dry eye is something that's common among people, and is even worse as we get older, especially in women, or if you have systemic conditions like Sjogren's syndrome or thyroid related conditions. But the main thing for a lot of people that causes dry eye, like I said before, is use of digital devices. For most of us, our work involves computers. We get home, we're on our tablets or other digital devices, trying to catch up on social media, trying to read up on emails, respond to mails. So at the end of the day, you find most times you're in front of digital devices and the eye tends to dry up fast. Dry eye is a combination of three things. Either the eye is not producing enough tears, or the tears evaporating faster than is being produced, or it is draining back into the lacrimal system faster than the rate at which it's being produced. So these are the three things that causes the eye to dry up. If we know these three things, then it's easier now to say, okay, how do we tackle them? So the main part I'm going to deal with first, because concerns for most patients is, when you say get dry eye drop, I go to the pharmacy. There are lots of a plethora of dry eye drops. I don't know which one to get. So question is, how do we approach this issue? So there are some things that you can do at home that can also help with dry eyes, and this include things like uh, your work habit. Most times in front of this, when you're at work, people don't tend to blink. They just focus on what they are doing. So like I said before, there's the 20-20-20 rule, which says for every 20 minutes take a 20 seconds break to focus at things that something, an object that's 20 feet away. This helps to relax the eye, and it also enhances blinking. Every time you blink, you pump new tears into the eye, the old one goes away, so it maintains the system. But if you don't blink enough, of course, there's not enough tears coming into the eyes. So, one of the things that causes the tears to evaporate faster than is being formed is if we don't have enough. Tears has three components to it. It has what we call mucus, it has water, then it has lipids, which is oily um, component to it. That oily component is the outermost part of the tear film. So that is what prevents the tears from evaporating too fast. One of the things that reduces the amount of oil in that composition is when the meibomian gland, which is the gland that produces that oil, is clogged. So for a lot of us, what we can do is called warm compress. Put a clean cloth in warm water, used to massage like the glands or the on the eyelashes, the lid. Just warm compress. Use it to massage. It helps. Sometimes you find when you actually put it enough, you find oil coming out. So it unclogs that dot. So warm compress is very good. Another thing you can do is lid hygiene. Put Q-tip in baby shampoo and use it to clean the eyelashes. That also helps a lot in terms of maintaining the oil film composition in the tears. So that way the tears won't evaporate too fast. Another thing you can do also is especially for those of us that are always in the air conditioned environment, we tend to just walk. At work, you're in an air conditioned room. In the car, you turn on the AC again. Then sometimes for those of us that live in this part of the world, in the winter also, what we should be doing is having a humidifier on. Humidifier adds moisture to the environment, so that way the tears doesn't evaporate fast again. So this is another option. Then omega-3 supplements. You get this from things like fish oil. Again, it has been shown that this also helps too. Then environment. We tend to just be on our screen all the time. Minimize screen time as much as possible, not just for adults, even for the kids. The same thing. If you can minimize the time you spend in front of your screen. If this doesn't work, of course, we have the option of tear drops. Most artificial teardrops are over the counter, they're really not prescribed. The question most patients ask is, I don't know which one to get. Of course, they are. I'm going to break it down. I'm going to do a video on how to select teardrops, artificial teardrops, but I'm just going to give little hints here. There are two types. There's the one that has preservative and the one that don't have preservative. The one that I usually suggest for most of my patients is the preservative free one because some patients react to preservatives, and that's when you see that I'm reacting to it. Most teardrops are non-medicinal, they're just viscous or thick water. All it does is lubricate the eye like body lotion, but specifically designed for the eyes. So you have the ones that have preservative, the ones that don't have preservative. The preservative one is to help the drop last longer on the shelf, so they last longer. The non-preserved ones don't last as much. But the drawback to the preserved ones is that sometimes some patients react to the preservatives. Then the other thing to look at is how thick the artificial teardrop itself is. Some of them are just water, but just a little viscous. So when you feel it's a little slimy, so that's the what helps it stay on the eye. There's the one with low viscosity, and there are some with high viscosity. Then there are some that are almost like ointments. Those ones are like really, really thick. The thicker it is, the longer it lasts on the eyes. But because it's thicker, also it tends to make the vision a little blurry for a little while. So that's why some people don't want the very thick ones, maybe like ointment or the hyper viscous teardrops. They just want the thin one that they can use and use on the go. So, but for other people, they don't want to be putting the drop all the time. So this is where the difference lies. The less viscous one, because it's less viscous, it's not very thick, so it doesn't last as long on the eye. So you have to put it more often, or put the drops more often. The thicker one, because it's thick, it stays longer on the eye. It doesn't evaporate fast. So you can put one in the morning and one in the evening, and it will still do the same job. But the less viscous one, you have to put like 3 or 4 times a day. Then you have the ointment ones that most time we recommend only use at night or when it's really bad. You can put it, it lasts longer, but you have to give it time to break for the eyes to break it down the first time so it doesn't stay too long. It doesn't make the vision too blurry. So these are the things with the artificial teardrop. But like I said, I'm going to do a specific video on choice of artificial teardrops. Then another thing that we now look at is sometimes we've looked at tears evaporation, evaporating faster than is being produced. Now we have to look at when the eye is not producing enough tears, what do you do? Here we can use the artificial tears again, or when it's really bad, there's a option of cyclosporin, which is called restasis, Restasis. This one obviously is not available in a lot of countries, so it depends on where you are. Restasis for a very long time wasn't available in Canada. Most patients here had to get it from either the US or they order it from India. But I think it's available in a couple of places right now. But outside, I don't know. But if you ask your doctor for Restasis, if you have really bad eyes, they should be able to tell you. Or you can check it online, it's available where you are. Then there's also the one they call liftigrast, which is called Zydra, Siidra. Also, these two, what they do is they help the eye produce tears, to stimulate production of tears. So when you don't produce enough tears and the teardrop doesn't cut it, this is the option that you have. Now we've looked at not producing enough tears. We've looked at tears evaporating faster than it does. The other option now is to look at if it's draining too fast. You're producing enough tears, it's staying on the it's not evaporating too fast, but it drains too fast. So the tear still doesn't stay on the eye for what it's supposed to do, what it's supposed to do. In this case, doctors usually do what we call a punctal plug, the little like cotton that they use to block the tear duct, so that the tears doesn't drain too fast. It gives it time to stay for the tear film to stay on the cornea and lubricate it before the blink reflex produces the next batch of tears. So dry eyes can also be caused by as a side effect of some medications like things antidepressants, antihistamines, and some blood pressure medications. So I'm not saying stop those medications, but talk to your family doctor about it. There should be a correlation between your family doctor and your eye doctor. Sometimes when you ask patients what kind of medication they're taking, they are hesitant to disclose the full information. But I guess something like this will make you understand why the eye doctor is asking for the medication that you take. So another thing also, contact lenses. Extended use of contact lenses can cause dry eye because it reduces the amount of oxygen getting to the eyes. So again, this is another area. So if you get dry eyes and you've been using your contact lenses for too long, cut down on the hours they use the contact lenses. That is something that you can do at home too, and it will help. So these are things that you can do at home. But if this still don't solve the problem, then obviously you have to go see your eye doctor. So there are ways out. Even if you cannot afford it, change your lifestyle habits, like we said before. Don't stay too long in front of the screen. If you're going to be there for a long time, make sure you're blinking often. Observe the 20-20-20 rule. So these are little tips that I thought I should share with you guys as far as remedies for dry eyes are concerned. Thank you.